All right, good afternoon. That's not right.
There we go.
Yeah, well, okay. Well, good afternoon. We're going to begin the committee hearing on Committee on Health. And we're going to start off today with House Bill 203, Representative Mark Newton. Yeah. Which one is that, one or two?
I like it. Thank you, Mr. Chairman. Yeah, I bring to the committee, House Bill 203. The, LC number we're working off of is LC 339305. I first want to thank the committee. I know we have some new members on this year, but this is an issue we've worked on a couple of years. One of our goals in this committee has been to, find ways we can safely and affordably take care of patients in Georgia by giving them options. And one of the new options we learned over the pandemic, but we've been learning for years now, is that telemedicine can be a great tool to use. It's just one of many tools that physicians and providers use to try to make care more convenient and affordable for the patients. We've been working together along with some of our friends in the hall for a couple of years on this when it comes to contact lens renewals. These are what we're describing here, and you'll see in the bill, is contact lens renewals, not the initial visit or the follow-up, but a renewal of contact lenses that are, number one, working fine for the patient, that are on a patient that doesn't have high-risk conditions like high blood pressure or diabetes or any corneal defects. So we've been looking for a way we could expand that and make it possible for patients to have the option of either an in-person visit for their uncomplicated renewal or a telemedicine visit, with the recognition that with how busy some lives are, that occasionally some of these people in particular that are addressed in this bill could really use the help, whether they're raising a family, working, or whatever, that telemedicine might be appropriate. We've worked together for a couple of years on this because while some states allow 3, 4, or 5 years of renewals, we wanted to make sure that we were being cautious and safe. So we've worked together with both our ophthalmologist and our optometrist, along with the people who do provide from other states who provide Georgia licensed renewals of well-functioning contacts through telemedicine visits. So we've worked together on this. That's what House Bill 203 does. It goes through and it allows a young person, I'll say, from 21 to 50 with no pre-existing conditions, as far as high-risk conditions that I mentioned earlier, like diabetes or high blood pressure, that would require kind of viewing the back of their eye as an important part of an annual exam. The ones where this is limited to get an eye assessment through telehealth, you'll see we reference in lines 64 and 66, just telemedicine and telehealth are like we've used in other sections of code, that somebody who's legally allowed to prescribe these, that's optometrist and ophthalmologist. It's not something I as an ER doctor can do, but highly trained specialists could do this to meet the vision needs of the patient, to use this assessment mechanism, to proper record keeping, proper sharing of records, so that if a patient on the next visit, which they would likely do, is able to take their prescription to another provider, maybe for an in-person visit for the following one, if they do elect to utilize telemedicine for one of their refills. So if you can see in line 157, you can only use the eye assessment if the patient has had an in-person eye exam in the previous 24 months. So this is a bill that we've worked on to perfect for a couple of years, and we would appreciate some favorable consideration. We think it's a small step for patients, but even that 1 year of renewal that's allowed, the one renewal without having to schedule an in-person exam, I think we've gotten to a point where all parties are confident that that's, number one, safe, number two, effective, which are kind of our goals in healthcare. And it also adds an extra option of both possibly affordability as well as convenience for the patient. So I'm happy to answer any questions on this. We do have others that are willing to speak to it to kind of confirm what I've discussed and add information.
Any questions from the committee members? Okay, we do have some people up here to speak. First off is Nick Chigilago. Am I pronouncing that right? Chigilago, okay. Yeah.
Thank you, Mr. Chair, members of the committee. Appreciate the opportunity to speak on the bill. Nick Shilligo, representing 1-800 Contacts. We are one of the telemedicine providers in this space that use board certified, state licensed ophthalmologists to do renewals for contact lenses. As Dr. Newton mentioned, we've been working with stakeholders on this bill for the last couple of years. We've tried to address all of the concerns that we have. I think we've come to a pretty good consensus on how we can increase access to care and lower costs for Georgians using these technologies while making sure that patients and citizens of the state remain safe. We would appreciate the support of members of the committee on the bill as drafted, and I'm happy to answer any questions that you guys have.
Any questions of the committee? Thank you very much.
Thank you.
Thank you, Mr. Chair, members of the committee, Aubrey Balad, General Counsel for the Georgia Optometric Association. First, I want to thank Dr. Newton for shepherding this through. We do appreciate it. I think all the stakeholders are in agreement. The summary was right on point. There's no need to belabor it. We have an alliance, a fragile but sincere alliance. We would hope there would be no amendments to the bill. And again, we appreciate the stakeholders working together, the ophthalmologists, the optometrists, 1-800, everyone coming into agreement. Thank you very much.
All right, do I hear a motion? Seconds? Do I hear a second? Second, good, okay. All those in favor say aye. All those opposed? Congratulations, you have your bill. All right, next up, Chairman Powell, HB 215.
Pretty simple,
Yeah.
pretty simple bill. Currently, nurses are all authorized by the nursing board. This deals specific with APRNs, that they have all the higher degrees of education and all of this. This basically provides for licensing so that the nursing board can then license them as a specialty. I can assure you, because of previous discussions, no attempt in this to go for hanging their own shingles. That's generally what it does. Went through the GORP committee this past year. GORP has approved this bill. The only other thing this does is allows PAs and APRNs, licensed APRNs, to prescribe the handicap stickers that you see. And of course, quite frankly, and I'm not a medical practitioner, I know in previous bills we've had things about prescriptive rights. Being able to prescribe that handicap sticker is probably more important than a lot of things to a lot of folks.
I can attest to that.
Amen.
All right, any questions from the committee?
Hey, Tom.
All right, I don't see any. We have a few folks who want to, Representative Jones.
On line 53, I'll be frank with you, sir, I wasn't able to get this. It says hold a multi-state license under Article 4 of this chapter. Does that mean that they hold something that would be the equivalent of the advanced certification? End of 53, end of 54? That's the concept.
That's on the Interstate
That
Compact
compact
Act.
license be of an advanced nature? Okay. Chairman Powell, just very quickly, sir, I'm not trying to muddy the waters here, but just ask, is there a way to consider giving them the presumption so they are presumed to be in, since it's going underneath the compact that we're already in? If they already have the advanced licensure, I'm not saying they shouldn't go through all these other fingerprints and everything, but why not give them the presumption that they're in day one and then have the licensing board opt them out X number of days or months later, if in fact they can prove for some reason that person is not of, I'll say, the skill
Well,
set.
it would certainly, my personal opinion, take somebody that has dealt with this. This is foreign territory to me.
Okay.
We deal with professional licensing on regulated industries. And in this particular case, it would take somebody that has a bit more knowledge of this, which I'm sure there's plenty of folks in here that do. They'll be glad to answer that question for you.
All right, thanks, Chairman Collins.
Oh, okay. First of all, do I hear any volunteers that want to answer the question? Representative Jones? Yeah.
Morning. I'd like to thank all of the members of the committee and Chair Hawkins. In response to your question, the compact licensure that is mentioned is for an RN license. There is an RN compact that is in place at this time, but we do not have an APRN compact at this time. Hopefully, we'll be able to have one in the future, but we wouldn't even be eligible for the APRN compact because APRNs do not hold a license in this state.
That, could we look at the compact bill to expand that? Do other states want to do that or no?
Well, the RN compact, of course, everyone in this country would love to be a part of the compact. And we would love to have a future APRN compact. But that is part and parcel of why this bill is so important, because APRNs at this time do not hold a license in this state. And in order to be a part of the compact and to have parity with other states, we would have to have a license just like they do.
Understood, but that still doesn't answer the question. I understand that we're saying we want to create this advanced licensure in Georgia, but if someone in a neighboring North Carolina has that licensure through the, why not just presume that they could come into Georgia versus it being that they have to prove themselves? That's what I'm asking.
There is no compact that exists in this state. In order for us to allow other individuals to come into our state and be part of a compact, we ourselves would have to be part of the compact, and we are not. In order for us to be a part of the compact, APRNs in this state would have to hold a license. So we're not even eligible to be a part of the compact. But if we were part of the compact and someone from North Carolina wanted to come here, yes, then they could presumably just go ahead and practice. They would not have to get a new license in this state.
Okay, it's 50-50, but okay, thank you.
Now that I have a little bit more knowledge, thanks to this pretty lady right here, I would tell you how we deal with interstate compacts and some of the legislation is currently pending. That if you're licensed from out of state and you come into Georgia, if all the educational requirements, the testing requirements, if all of those are comparable, then they do reciprocity, which is basically what being a member of the compact would do. If it's not, they would still be scrutinized by the board if it be sure there's no difference in the education and experience such as that. So then there might be other specifications that might be put on. Mhm.
Representative Mitchell.
Yeah, thank you, Mr. Chairman. I'm very familiar with the issue and very familiar with the author's work on this bill. I think it's a great effort. And as a result, would like to offer a due pass motion when it's appropriate. Yeah, gee, and that speech was compelling too. Don't know if I can replicate it. What I said was, I'm very familiar with the issue and the author's hard work on this issue, how it would benefit Georgians. And as a result, I'm prepared to offer a due pass motion when it's appropriate.
Not appropriate right now. You can do that, but you got to.
Let me just add that the witness testimony may change my mind.
Thank you. Let me say Aubrey Valines.
Mr. Chairman, Aubrey Valance with the Advanced Practice Registered Nurses. We support the legislation. I'll answer any questions you may have. I'm not going to belabor the point we ask for support. Thank you very much.
Okay, thank you. Next up, Michelle Nelson.
Thank you very much for an opportunity to speak to the committee. I just want to let you know, my name is Dr. Michelle Nelson, and I am the Director of Graduate Programs at a large urban University here in Georgia. And I just want to share with you that I'm an academician, a researcher, a leader, and I wear a lot of hats. But my most important hat here in Georgia is that I'm an RN. And as an RN for nearly 30 years and a family nurse practitioner for 20 years, I think it is incredibly important that we grant other APRNs like myself a license, and it is important. The importance here is to be able to safeguard the public. Our charge as advanced practice nurses is to be able to make sure that we are providing quality, safe, cost-effective care. And the best way to do that is to be able to adequately regulate an APRN license. By adequately regulating, it gives us an opportunity to make sure that advanced practice nurses like myself who are practicing are giving the best quality care to Georgians who deserve it. It also gives us an opportunity to increase access. I just want to also share with you that the National Council of State Boards of Nurses has also said, which is one of our national boards, is that their message for boards of nursing is on the benefits of adopting model requirements that is to fulfill your public protection role and have confidence that licensed APRNs entering your state are competent. And they also have messaging for legislators. And that messaging is be accountable to your constituents, that an APRN regulatory model is being employed in recognition of public protection. And so therefore APRN regulation must advance accordingly to allow APRNs to care for patients in a safe environment to full potential of their nursing knowledge and skill. Thank you so much for letting me address you. And if you have any questions, please.
Which mic are you? Representative Parsons. Okay, thank you.
And I
Gotcha.
apologize. Somebody, Chairman Powell probably went over this and I was late. I was in another meeting. I apologize. I do want to, and I think I remember asking this question a long time, years ago.
Yes.
So to be considered an advanced nurse practitioner currently, if you have the proper advanced degree in whatever field medical field that you'd have to have it in, that qualifies you currently, you could call yourself an advanced nurse practitioner. Is that correct?
If you have gone through an accredited program,
Okay.
accredited by national organizations, you have the education, you have the training, yes, you would be able to get an authorization to practice that is tied to your RN license. You only have an RN license.
Just not like, there is no license that says that you're licensed as an advanced nurse practitioner. Is that correct? And that's what you're trying to do?
That is
Okay,
correct.
thank you.
Hey, thank you for being here and thank you for the bill. I think it's a good goal. I'm just curious, I know you mentioned they're overseen by the nursing board. But obviously practicing as an APRN, whereas nurses often just primarily carry out orders and do a lot of things as an APRN, you'd be doing history, physical, making a diagnosis, and then
Assessment,
writing
management.
orders and then writing follow-up orders. Of the nursing board, how many are APRNs and how many are there total? I'm just curious, when you get this APRN license, which I'm going to support, I intend to support, are just the APRN members of the board the ones that oversee what is really a different kind of practice than a standard RN or BSN or LPN that might have a nursing license? How is it just the APRN members of the board that oversee APRN care?
So,
And I don't know the numbers on them.
so
you
we
can
have
help.
approximately 180,000 nurses in the state of Georgia, about 180,000, of which there are approximately 15,000 advanced practice nurses. And we're talking about nurse practitioners, nurse anesthetists, midwives, and clinical nurse specialists. Those 15,000 are allowed to assess, diagnose, plan, put in place interventions, manage, treat. So only that subset, since they've gone through the additional programs, the clinical hours, they've taken a certifying exam, and they maintain many hours of continuing education annually. Those are the ones that are able to do those advanced skills.
If I might, Mr. Chairman,
Yeah.
I guess my follow-up question is, or is how large is the entire Board of Nursing? Do you know that number offhand or just someone?
In terms of the amount of
The number of
nurses in the
nurses on
state,
on the board? No, the board.
on the
'Cause
board of
this is a
nursing,
license from the Board of Nursing, right?
yes, this
Are
would be
there
a
about
license for the
30
Board of
members,
Nursing.
20 members? Does anybody know?
I don't want to misspeak. I am not sure how many members there are on the Board of Nursing. I don't know. Anybody else in the room has that?
Do you know how many of them also hold an APRN certification?
Quite a few of them.
But the RNs will also be overseeing the care delivered by the APRNs, even though they have not had that higher level of training. Is that correct?
Can you please rephrase your question? What are you saying?
I was just wondering if it was a subset of the nursing board, the APRNs on the nursing board, who oversaw what's appropriate for APRNs as opposed to RNs that may not have had the same level of training, but they're on the board of nursing.
Mhm.
It's more of an information question.
So there are multiple individuals. I would not be able to answer right now how many of them are responsible for overseeing APRN licensure. But I can tell you that APRNs are not only overseen by the Board of Nursing, but also the Composite Medical Board. Those
Good point.
agreements that they have with their supervising physicians. So there's oversight on multiple levels.
That's a good point, right?
Mhm.
Because it's working under a protocol agreement. You're right. It does have some dual oversight to allow for the fact that they're doing more medical care, advanced nursing care than a normal RN does. But I
That
think
is correct. So the authorizations are overseen by the Board of Nursing, and the protocol agreements are overseen by the Composite Medical Board.
Thank you.
You're welcome.
I look forward to supporting it. Thank you.
Thank you.
All right. Thank
Other
you very
questions?
much. Appreciate it. Next up is Nancy Harlow, Hurlock, excuse me, Hurlock. Nancy Hurlock? Nancy's not here. Okay. How about Tim Davis? Tim Davis here?
Hello, everyone. Thank you to the members of the committee for allowing me to testify today. My name is Tim Davis. I represent the Georgia Nurses Association, and we just wanted to echo the sentiments of the other people who came up and testified and say that ask for your favorable consideration of this important piece of legislation, which will allow us from a workforce standpoint to track our APRNs, where they are, where they're working, and in what capacity.
Okay. Any questions from the committee? Okay. Next up, Servio Jean, but, I'm sorry, I'm having a little trouble reading your handwriting.
Thank you, Chairman Hawkins. Thank you, the Health Committee, for allowing me to speak on behalf of the portion of that bill, HB 215. As you know, my name is Servio. I'm a nurse practitioner student at Dayton State University. I have the privilege to have Dr. Nelson as my director. Wonderful. She's doing a great job for the state of Georgia, and we are on excellent hand. So I'm asking you guys to trust her. She knows what she's doing, and we have a great backup here in Georgia. So, like I say, I'm here to speak on the importance of the need of an APRN license. It takes me a lot of time, commitment, and money to achieve my goal of becoming a family nurse practitioner. It will be worth for me to get full access as a family nurse practitioner to get that authorization to act on behalf of the Georgians and provide the quality care that we really need here in Georgia. I am taking advanced classes at this moment that will qualify me to hold that license here in Georgia. And I want to be able to practice to the highest level of education, certification, and training that's required to do that. So I'm requesting formal license be granted to all family nurse practitioners that's practicing right now, and student family nurse practitioner as I am at this moment. Like any physician, PAs, pharmacists, or any other people that require a license, hold them here in Georgia. Why not us as a family nurse practitioners? So the HB 215 will bring conformity for the most others, for like other states, okay, that's practicing, get full access to the license. And it will bring a more safeguard to the public that we serve here in Georgia, knowing that we are certified, knowing that we have that accredibility here in the state of Georgia. So having a formal license number, it's not the scope of practice, but it's the year, it's the effort that we put on that education that we receive from accredited school here in Georgia that would qualify us to have that license. So I am asking you guys to really consider that, and let's give Georgia the care that's the need. At this moment, we have a shortage of everything, nurses, doctors. Myself, I came from another state. It takes me 6 months to get an appointment to a doctor's office because of the shortage. We are here to solve that problem, and that bill will solve that problem, give us that license that we need. It's a great step the state of Georgia will do in providing quality care to every Georgian here. Thank you so much.
Any questions from the committee? Okay, thank you, sir. That is the end of our witness list. Representative Mitchell.
Thank you, Mr. Chair, for giving me this privilege of making the motion to do pass this good legislation.
Thank you, sir. Before we move on that, I asked the chairman, would you like any follow-up or comments from the author of the bill? Hey,
Please
you've got a friend.
Yeah, well, please don't forget that, Mr. Chairman.
All right. Do I hear a second? All those in favor say aye. All those opposed? Mr. Chairman, you got your bill. Thank you. I'm sure you will. Thanks. HB 278, Representative LaHood. And this is a hearing only on this bill.
Thank you, Mr. Chairman and committee. House Bill 278, this isn't the first time this bill has been introduced. We ran out of time last year to give it a thorough debate, but this is related to athletic trainers, and it does a few things. It cleans up some language, removes some obsolete language, and it does some clarifying. And the most substantive thing, I'll just get right to it, that we'll probably draw some questions and comments, is on line 12, where it changes the word injury to condition. And currently today, as I understand it, a physician can refer a patient to an athletic trainer to be treated for a variety of reasons. So it makes sense to strike the word injury and change it to condition, so that it's clearly understood that if the physician feels like the athletic trainer can, treat whether it's an injury or condition, it shouldn't matter whether it was activity related or setting related. In other words, a sprained knee could happen on a sports field, or it could happen on the stairs in your house. And so the treatment would be the same in a lot of cases. And the physician will make that determination on where to refer the patient to. Again, I think that's the most, the change that would draw the most commentary. Everything else is more of a cleanup in nature.
Right, okay. Any questions from the committee? Representative Mitchell.
Yeah, Chairman, what's the significance of changing the word injury for condition?
Basically, to clarify that the reason that the treatment is needed is where it happened and how it happened is not relevant, to the treatment. Like I said, an athletic trainer, the name suggests that, they treat athletic injuries, and they do. A lot of sports teams employ athletic trainers. But sometimes sometimes it's appropriate, and physicians are already referring patients to athletic trainers who may have conditions that did not result from an athletic injury.
I see.
And so again, this is more, clarifying and cleaning up to what's really already happening.
Any other questions from the committee? I'm not sure.
None,
Asiac, is that you?
none.
Go ahead.
Thank you, Mr. Chairman. Thank you for being here. On line 21, it talks about evaluation. You were saying referral, but in here it does say evaluation. Upon the advice and consent of the physician, carries out the prevention, recognition, evaluation. So they'll be evaluating too? The
Line
trainer.
20, let's see, line 21 is already in current law. So upon the advice and consent of a physician, they're carrying out these services listed here, yes.
Okay, thank you.
Okay. Yes, ma'am. Schofield, Representative Schofield.
Thank you, Mr. Chair. So I just had a quick question. I'm curious, how does it change the breadth of their work to change it from injury to condition? And the other part of that is what are examples of conditions that they can't treat now and would like to?
Okay, so I don't think it changes a whole lot on what an athletic trainer will be treating, because right now it's the physician's the gatekeeper today, and the physician will continue to be, the referral. Will refer the patient to an athletic trainer, and the other option would be a physical therapist, as I understand it. And so I've heard from some of the committee members on this committee and lots of others, members recently, since this bill was scheduled for the hearing, that they've heard from, local clinics, athletic trainers, of course, but also some physical therapists that have said they don't see a problem with the bill.
Representative Kelly.
Thank you, Mr. Chairman. Chairman LaHood, thank you for the work that you're putting into this legislation. I guess I have two questions in regard to language that you're striking from the code sections. My first would be on lines 25 through 28, where it talks about nothing in this code section, but shall be construed to require licensure of elementary or secondary school teachers, coaches, or authorized volunteers who do not hold themselves out to the public as athletic trainers. I just was hoping maybe you could elaborate on the need to strike that.
Yep. So that's a great question. And striking this language doesn't prevent these institutions from having someone designated, on the sidelines or at an event to render first aid type care. But it would require, if they were going to perform any of the services listed, starting on line, I believe it's 21 and 22, they would need to be credentialed.
Okay, and then, Mr. Chairman, if I can have one more follow-up.
Go ahead.
Can you speak to line 70 through 72 as well, that you're striking, where it was kind of grandfathering in people with license before July 1 of 2004? What's going to happen to those individuals now?
You said line 71?
70 through 72. It looks like, I guess maybe the last time we redid this was probably in January of 2004. And it looks like we may have grandfathered some people in. And so I'm just wondering, what are we doing to those folks now?
The way I understand, the necessity of this is that it's removing references the state licensure exam, which is no longer administered and addresses changes that are aligned with today's credentialing organization. Your specific question, what happens to these people?
Look, will they have to come back and get recertified or lose their, quote unquote grandfather status?
That- I do not believe that's the intent at all. And I believe there's a plan for that, but I can get with you later for
Let's let
clarification.
legislative council speak to that.
Yeah, thank you.
Subsection A is stricken, so B is stricken, it's directly related to that, so it's basically takes
Did that answer your question?
Either answered or maybe I got stuff more confused, but I'll figure it out.
We're here to help.
Yes, sir.
Representative Newton.
Thank you, Mr. Chairman. I guess kind of to that same section, if we will, on line 68, 69, it looks like there was a very specific board, National Athletic Trainers Board of Certification, that was having licensure. But now that we're not requiring the curriculum requirements in line 61 and 62, I'm just curious, who is the Board of Certification with the capital letters on board and certification? Is that just a generic, is that an athletic trainer board? Are we supposed to understand that, or maybe I didn't look in the definitions, but I just don't know of a group called Board of Certification. It seems kind of like a broad name for something that would only apply to athletic trainers.
Yeah, I'm looking in some notes here. Apparently there's been some changes to the way the state exam, the way licenses are issued. Where there's a new credentialing board, which is looks like the Board of Certification. And I've got notes here from the Athletic Trainer Association that I'm looking through to see if I can answer your questions.
It may refer back to line 29 is that where board, at least the word board means the Georgia Board of Athletic Trainers. I don't know if that would be the Board of Certification, or maybe that's something we can clarify. Maybe that's why the chairman decided to make it a hearing today.
The BOC Board of Certification is the national governing body that administers the certification exam.
But that, does it have not, it doesn't have any preface to the word Board of Certification? It's not say athletic trainer or?
I believe it is specific to athletic trainers.
I mean, I have a Board of Certification in emergency medicine, but
But you're saying
it-
it's specific to emergency
Sure.
medicine, right?
Well,
I'll be glad to wait on.
Yeah,
We'll follow
I'm
up.
sorry I don't have that
Offline.
answer right in front of me, but it would be easy to get.
Okay. I will say this is a hearing only, so we're working through some things. And you all making good points. Representative Maziak.
So thank you, Mr. Chairman. So there is a board through the Secretary of State's office that will administer some kind of licensure? Is that where we're headed here?
Well, again, as I understand it, this is already happening and this is needed to align with what's already happening.
So there's already a board of athletic trainers, right?
Well, I believe it's the Board of Certification, the new language that we're putting in here
Okay,
that
okay,
already exists, but I need to get clarification on that.
right. Representative Sharper.
Thank you, Chairman. I just have a question for you. I guess when someone has a condition or so, and you have physicians would be the medical director for like your regular physical therapist. And they operate under that. Now, the athletic trainers, most of the time, a lot of athletic trainers, they are associated with, possible schools or things like that. Now, does this leave room for, I guess, a position as a medical director that has an office or so to have athletic trainers work for them?
So your question is,
if I'm a physician and I have physical therapists that people send to me, okay? Now, we know that athletic trainers a lot of times work for institutions, things like that. But if I'm a physician here and I want to hire athletic trainers to work under my medical direction, does that allow that to happen?
It's my understanding that yes. But I don't think there's anything preventing that from happening now.
Okay.
Yeah.
All right.
So thank you.
Okay.
And I did just get some clarification sent to me from the athletic trainers. They said the Board of Certification is a national governing body. The state board no longer gives a state test. They reciprocate with successful completion of the national test. The Board of Certification already exists.
That's a national board. is what you're
Right.
saying. Okay. We have signed up to speak to this, Representative Maynard. Okay. Let's see who I have on here next. Aubrey Valines. Good thing we only have the 3 bills for you to speak to today.
Thank you, Mr. Chairman, members of the committee. I do not rise in opposition or support of the bill. I'm with the Georgia Chiropractic Association. I have some questions I'd like to ask because I think the bill is full of what we would call unintended consequences. If I could first refer you to line 12, the new word condition that replaces injury. Condition is not defined. However, if you Googled health conditions, first thing that comes up, the 10 most common health conditions in the United States are heart disease, cancer, chronic lower respiratory disease, obesity, Alzheimer's, diabetes, substance abuse disorders, the flu, kidney disease, and mental health conditions. Right now, their practice is limited to the participation as a result of such participation, line 12 and 13, in exercise, sports, games, or recreational activities, or any activities regarding physical strength. It takes the part out about sports, which is how we really know them as athletic directors. Now they would be, I assume, would be allowed to treat car accidents, workers' compensation, slip and fall, gardening accidents, house accidents. As long as it involved, like when I walked up here, it required some agility and some mobility for me to get here and some strength. I just want you to understand what this does. You know, if I'm out walking, for example, I'm giving real examples, and I hurt my knee or my arthritis flars up, which is a condition, not an injury, resulting of an injury, and I gain 20 pounds, are you going to be able to treat my obesity by using those machines? And now they have machines they can put on you and have you lose weight. I just have lots of questions regarding unintended consequences. Conditions is not defined, and you're taking it out. You're still calling them athletic trainers, but you're taking out exercise, sports, games, or recreational activities whereby without respect to where and how the condition occurs. You're greatly broad, and I'll be happy to answer any questions.
Any questions from the committee? Thank you, sir.
Thank you, Mr. Chairman.
Kathleen Geist. Or Geist.
Good afternoon, and thank you, Mr. Chairman and members of the committee. My name is Kathleen Geist. I'm currently serving as president of the American Physical Therapy Association of Georgia. And I'm speaking today on behalf of Mr. Tom Bauer, who is a lobbyist for the Occupational Therapy Association, who also has serious concerns about HB 278's proposal to significantly increase the scope of practice of the athletic trainer profession without adequate need or plausible explanation. The effect of HB 278 would be to change the focus of athletic trainer treatment on injury to condition, a leap from dealing with acute problems to chronic conditions. When paired with the removal of language tying the injury to one that results from athletic or recreational activities, the scope of practice of an athletic trainer could conceivably allow him or her to treat a myriad of conditions, such as heart disease or gastrointestinal disorders, under the umbrella of the term condition, which results from a broad set of exercise or activity. In fact, the National Athletic Trainer Association lists such conditions of which an athletic trainer should be aware in its educational competencies in its section relating to diagnosis. Interestingly, they are mentioned in the context of acute care, not chronic care. I appreciate Representative LaHood's willingness to discuss this issue when the identical bill was introduced in the 2021-2022 session. He referred us to representatives of the AT Association and Licensing Board who explained that this proposed change in the scope of practice of an AT was needed because the board was having trouble policing alleged violations of practicing athletic training without a license, presumably because the scope of practice needed further clarification. When asked several times to provide examples, I was told that confidentiality prevented sharing such examples. However, any licensing board can provide examples of its cases by redacting the names of the persons involved. This refusal to provide examples is the reason Mr. Tom Bauer referred to the proposed change of scope of practice being sought without showing need or giving a plausible explanation. The Georgia Occupational Therapy Association would request that HB 278 be held for more reflection. Thank you for hearing my comments.
Thank you. Any questions from the committee? Thank you, ma'am. Next up, Daniel Dale, Dr. Daniel Dale.
Thank you, Mr. Chairman. Thank you, esteemed members of the committee. My name is Daniel Dale. I'm a doctor of physical therapy and licensed physical therapist and the immediate past president of APTA Georgia. We're appreciative of the efforts of the Georgia Athletic Trainers Association for bringing this bill to the attention of APTA Georgia, and also thank you to Representative LaHood. We appreciate the comments here. However, we still have unresolved concerns as an association related to the language in this bill, as we believe it does not do what the intention of the bill is proposed as, and we believe it does enhance the scope of practice for the athletic trainer that may endanger the public. As members of the committee may be aware, this bill has come before the committee before, and I have actually testified on the bill before as well, so I won't take too much time in reiterating concerns about the proposed language. We understand the intent of the bill cleans up language in the Practice Act, and our main issues are, as Representative LaHood stated, on Section 1, lines 12 through 15. Again, using the word, as Mr. Valines mentioned about condition, a usually defective state of health, we feel that that changes drastically the intent of the bill and revolving around injury. We feel that a change in the definition of the word condition would allow an athletic trainer to potentially expand scope and treat virtually all populations. This could include individuals with neurologic complications, children with developmental conditions, internal conditions, older adults with dementia, cognitive disorders, et cetera, as those would all be considered conditions rather than injuries. In previous discussions with the Georgia Athletic Trainers Association, we were told the change was at the request of the state board, as mentioned by Dr. Geist. And we believe, however, we've been prompted and not received any clarification on conditions and how this would help the Georgia board enhance their ability to discipline. We believe the legislation expands what's already one of the broader practice acts in the country for athletic trainers, specifically as we move away from injury to condition. It's incredibly permissive. I won't read here, but knowing in the Southeast, multiple practice acts, including Alabama, Louisiana, Mississippi, North Carolina, South Carolina, and Tennessee, all include definitions of athletic injury or athletic condition, but not just condition by itself. So again, on behalf of the American Physical Therapy Association of Georgia, we would oppose the language change in line 15 and would be welcome to further discussion to help clarify that in coordination with our athletic trainers.
Thank you, sir. Representative Parsons.
Thank you, Chairman. I wanted to ask, in relation to the questions been raised about the definition of injury, changing to condition, but wouldn't that be taken care of though in lines 19 through 24, where it has a definition of the athletic trainer? I mean, in fact, even before that, it says nothing in this paragraph shall be construed to expand the scope of practice for an athletic trainer. Then it says athletic trainer means a person with specific qualifications set forth in below there, who upon the advice and consent of a physician carries out the practice of prevention, recognition, evaluation, management, disposition, treatment, and rehabilitation of athletic injuries. I mean, it says right there that it has to be an athletic condition. I mean, doesn't that, I'm asking you, don't you think that actually, would, even though the definition has been changed to a condition, it seems to me like that language right there, says it would be an athletic injury or athletic condition, and would be under the consent, advice of a physician to carry it out. I mean, doesn't that actually take care of that concern that you had?
I would agree that the language that you're mentioning seems to make it clearer. So then I would question what would be the need for the change to condition earlier. Because it should reference the same throughout the bill.
Well, I would think that probably because an injury is such, we think of an injury as being, I think it seems to me that the word injury confines it to a much more specific situation than we're just saying that not just an injury as a broken ankle or dislocated shoulder or whatever, but it could go beyond that, which I think of as being an injury. I'm just asking you if you don't think that actually takes care of that.
I thank you for the question. I think the language, what's problematic is that it refers to two separate things in two different places. If this were to pass, you would have language that refers to a condition, which is distinctly separate from an athletic injury. So you have one mention of the bill mentioning condition, one mentioning injury, and it, I think, would be unclear as to how you
Well,
would
it doesn't
define.
really. This is all in section 1. It defines an athletic injury and it says what it is, the condition, and it goes on. And then right in the next paragraph, it says that we're talking about rehabilitation of athletic injuries. An athletic injury would be an athletic condition as defined down here. It seems, I'm just asking you, I don't know. I'm not a doctor, not a physician.
Let's ask one. Go ahead.
I guess the previous language, which isn't changed online that you mentioned, I guess athletic injuries on the second page. It's on line 22, where it talks about rehabilitation of athletic injuries. We have to remember that we've changed the definition of athletic injuries to a condition unassociated with athletics.
Well, that right there, those.
Online, we changed it on line 12 when we changed the word injury to condition, and we took out anything about sports and games. So your normal reading of athletic injury on line 22, to think that it only applies to athletic injuries, this bill would redefine athletic injuries to any condition associated with exertion.
That is true. Yeah.
So I think it does sound like on the second page, it's still an athletic trainer, but not if section 1, line 12 goes
Okay.
into effect.
Thank you. You are the physician. As I said, I'm not one, and
I'm not an
I trust what.
So you have to ask some others, but
Betsy, you got an idea on this?
Well, I actually, in agree with Chair Park, where you have to read the whole thing in context. So, on line 15 and 16, nothing in this paragraph should be construed to expand the practice of athletic training beyond the determination of revising the specific pieces of paragraph 2, which is the next definition of the parts and medicine. And it's confined to whatever the advice and consent of the physician is. So unless the physician can be out there saying that the athletic trainer can treat heart conditions, then, it's getting, outside the parameters of that here. You have to read both those paragraphs.
Right.
Representative Jackson. Oh, that was for you. Oh, okay. Excuse me. Representative Kelly.
Thank you, Mr. Chairman. I'm kind of looking at, I see in that first section lines, 12 through 15, we're changing injury to condition, and I want maybe somebody in the medical community to explain to me the significance of that classification. But when I look at what we've struck here, I can understand how some would say we're expanding outside of exercises, sports, games, or recreational activities, except before we struck it, the original language that exists today then has a comma or any activities requiring physical strength, agility, flexibility, range of motion, speed, or stamina. So that's, I would almost in my mind think that we're already allowing them to treat those situations to begin with. Is that correct? And so that was just a point I wanted to make, and I wanted to get clarification as to whether I was reading it the right way. And I am? All right. Thank you.
You wouldn't have to be an injury attorney, would you?
Uh,
I haven't
it's-
seen you on television yet.
And I'm
That's
trying to,
one.
I'm trying to figure out whether I can expand it into conditions as well. But
Well,
really,
look
can
for an
somebody,
opportunity, aren't you?
can somebody explain to me the difference in what injury and condition means in terms of medical terminology? Because I really don't know that. I don't think it's an expansion, except unless it's being done with the difference in the word injury or condition.
Well, I would say a condition occurs at any time, and injuries, just what an injury is, due to a result of an accident or some physical. And a condition, you could be born with condition.
Okay.
If you're born with an injury, you got a tough mama. All right, now who we got next? Who we got? Sharper, Representative Sharper.
All right, thank you. Just a quick question also. In that space of rehabilitation, is there a backlog, you think, of our citizens having to get into physical therapy and things like that?
Yes, sir. I think there is backlog, and that was echoing comments of the previous discussion. I think here in Georgia, we have citizens that need to be served at all levels in regards to healthcare.
Okay, so basically, I'm just putting it out there. So if you had more athletic trainers that can do these things, would that help the citizens?
If it were consistent with their education and training and it was safe to provide to the public, I believe it could.
All right, second thing, so if we have a patient who had a stroke maybe, all right, normally they have to go back for physical therapy. In that sense, that would normally be in the physical therapy space, or is that okay now for athletic trainers to treat somebody that's had a stroke to come back after a stroke?
I think based on the language that's proposed, that could be considered a condition, and I'm not versed to speak on the education and training that are received in athletic training programs. I'm not an expert in that, but I don't believe that that is contained as part of their training right now.
Okay, can someone answer that for us, the athletic trainers? Is that something that they're doing now? The person have a stroke, they gotta come back, get rehab. Are athletic trainers doing that? Anybody? All right, because I mean, something like that, go ahead.
You're not treating them now. I mean, they're only doing injuries right now. So
Right,
Stroke's not an injury.
but this, go ahead.
If I could, I just want to clarify again that a physician can already refer a patient to an athletic trainer for a situation like you described.
A stroke?
They could.
Is an accident, injury, is an injury, transit TIA is an injury.
Well,
It's an injury?
Nothing-
TIA is an injury?
Yeah.
I know what a
Right.
TIA is, that doesn't, but anyway.
I'd like to go back
As a
to
result,
something
right.
Representative Kelly mentioned a while ago. We're not adding
Right. Okay.
the scope. We're clarifying. And again, the physician would have to refer the patient, for the whatever treatment they deem necessary. And I also want to bring to your attention that this is no other healthcare provider is confined to a setting where an injury or condition happened, where it happened. But athletic trainers, the way this is worded, it suggests that the condition or injury had to have happened in an athletic setting. Athletic trainers focus their efforts towards a physically active population. So it could be, somebody that's, walking laps around their house in their yard that sprained an ankle or twisted a knee or, has a reason to be treated. And this just goes to clarify that it didn't necessarily happen in a sports setting.
Okay. That's what I was, looking at the big picture, because when you add physicians in and there being the medical director over it, kind of them saying, okay, this physical trainer can do this, this athletic trainer can treat this because this patient came to me with whatever the situation is and it falls under scope. But I just want to make sure that the athletic trainer is not bleeding over into, what they're really not supposed to be doing in a sense.
Right.
Representative Petrie.
Thank you, Mr. Chairman. Representative LaHood, so to be clear, your intention is not to expand the scope of practice, correct?
That is correct.
But clearly, regardless of which side is right, there's a lack of clarity in the language. So which by the way, is an issue anyway, because we should never pass a bill that it lacks clarity. So I'm glad it's a hearing only. Perhaps we can work on the language but I think it needs to be clear. There's no attempt, and the language needs to be concrete, that there is no expansion in the scope of practice of these athletic trainers.
Right.
That would be my recommendation.
And I appreciate the comment and all the comments, but I would disagree that this is unclear. It's not expanding the scope.
Right. Representative Corbett.
Thank you, Mr. Chairman. I just had one question. The football game last night, was it an athletic trainer that fixed Patrick Mahomes' ankle?
Probably was. You think it was a physician? Well, I can tell you, my daughter was an athletic trainer at Georgia, and she did go out on the field with football players.
They're the MVP.
And, and I want to tell you, her training was very extensive. She went on to become a physical therapist at Savannah, so. Okay, let's see. Representative Newton.
I guess, and I don't know anything about the training that this new board of certification, I would argue that a condition is Representative Hood, I'd say a condition might include asthma, it might include chest pain. It could include some things that are, and I don't know anything about the curriculum for the college or university that they may have gone to, but it does look like in 61 through 63, we take out the curriculum requirements of a college or university approved by the board. I don't know if their training has changed from dealing with athletic injuries, which was kind of the original thought of most of us as parents, or but that passing out low blood glucose, chest pain, wheezing or asthma, those would all be conditions that weren't necessarily injuries. And I would argue those might be considered an expansion. It may very well be that their training is expanded as well. And they're not inappropriate, but I would think they're potentially things that we have not typically looked to an athletic trainer to treat that would be fairly new. Certainly head injuries are an injury, but and all athletic trainers have to be adept at dealing with those, and they're priceless. Believe me, I've had with 4 kids in sports, they've been great to have on the sidelines, but I do think it could be considered an expansion of scope, and without figuring out whether or not treating asthma and chest pain and low blood sugar is something that they're trained to do. I don't know enough about their training, so maybe I can learn more.
Yeah, and good point. And, I'm not an expert on their training either. But I do believe they get training on a variety of conditions, even though the intent is for them to focus on, conditions that were created due to some, physical activity.
That's exactly what I was going to say. You may consider a redefinition of a condition as a result of a physical accident or activity. Activity would be a better word. Yes, exactly. I think that's the path we're going down. Any other questions or comments? Okay, thank you very much, Representative LaHood.
Well, thank you for the hearing.
You're welcome. I think we've had a very good, thorough discussion on that. I want to thank everybody for coming today, and our committee now is closed.